What's going on, everybody? Welcome to another episode of Igniting Hope Radio. I am one of your co-hosts, Sherman Webb-Middlebrooks, the lifelong Buffalo resident, full-time Black man, and I am the Men's Health Project Manager over here at the Buffalo Center for Health Equity. Got something new and different for you. Got my man here, a friend that I've had for a long time, who's going to be joining me on this journey, having these conversations and discussions around our health and wellness and the social determinants of our health. He's a medical professional outside of just being a good brother in general. I'm going to let him go ahead and run down his title, his credentials, and what he has to offer you in the Buffalo community here on the Igniting Hope platform. So go ahead, brother.
Hey, man. Y'all may know me. I'm Trev. I'm a registered nurse. For people that don't know me and people that know me in other platforms that don't know me and what I do, I'm a registered nurse. I've been a nurse for about 6 years. I work in emergency medicine. So obviously I feel like I got a lot to bring to this health and wellness area. So we're going to get into it today.
Yeah, man, definitely. I really appreciate that. Just because, first and foremost, to give you your flowers, we don't have a whole lot of Black men that are visible in the health and wellness space, particularly in emergency medicine, to the degree and to the level that you have arrived at. So definitely want to appreciate you for just being visible, because folks need to see people like you existing in community. You know what I'm saying? You're a cool dude. Yeah.
For sure.
Right. So I guess just getting before we get into today's topic, which I want to talk about, like health literacy and literacy in general, just give folks a little bit of your background and why you decided to get into the field of medicine as a young Black man. Because I know when we was in school together, I knew you was gonna grow up and be a comedian.
So coming out of high school, I felt like I didn't really know what I wanted to do. I went to McKinley, for people that live in Buffalo. That's like a vocational school. So we had like carpentry, plumbing, stuff like that. Like, like a lot of trades. And initially I went to school. I went to ECC for construction management. I thought I wanted to stay in construction, be a construction manager, and, go down that path. And as I started to do it, I kind of was like bored with it. So I would not go to class. I would go to school, not go to class. I would just, I was catching the bus. I would catch the bus to school and then just chill, like not do nothing. I would just go to school, chill with my friends, and then go home. So like I did that for like my early 20s. And then I don't know, something clicked. I always had in the back of my mind I wanted to be a doctor. So I did some research on that. And I decided that I didn't want to go to school for all them years because I really don't like school. So I settled on, I decided that, well, not even settled. I just decided that I wanted to be a nurse practitioner, which the first step of being a nurse practitioner, you have to have your RN. So I set a goal, went back to school, got my RN. I've been working as an RN for about 6 years now. It'll be 6 years in July. Always wanted to work in the ER, emergency departments. I went and secured a position in the emergency department. Then I started to travel. So I've been a travel nurse for about 4 years, primarily ER or only ER. So yeah, that's pretty much how I got into the health field. Yeah.
No, that's dope.
To make a long story short.
Yeah, no, but that's a good story though, because I think it's a story that shows determination and people's need to pivot sometimes in life, right? But then also just finding your purpose, and finding a way to not only support yourself but contribute to our community in general. So definitely want to give you your flowers and your respect and your credit for that, bro. So today's topic, we're discussing different social determinants of health on this platform. And so the determinant of health, this coffee about to kick in. I'm trying not to stumble and fumble over these words, man. But we're talking about education and literacy levels in particular. So as a as an individual who's working in the medical field, like what do you think the benefits of being health literate has on a person's health outcomes, and what do you think the negative impacts on being illiterate when it comes to health terms can have on a
Well,
person's outcomes?
I will say most like I'm pretty sure it's been studies. They say like the average education for an American is like the fourth grade. They got like a fourth grade education. You see that a
Yeah.
lot in healthcare, especially in like emergency rooms and emergency medicine.
Okay.
A lot of people like don't understand how the human body works, or like when they get sick what they should do when they're sick, or even just a diet, what a normal diet looks like, or just health compliance at all, like just taking care of yourself. um it's been plenty of times where you get a patient in and they'll have like a runny nose or something, like, and they'll ask for antibiotics. Like if you know anything about how viruses or like bacteria works, antibiotics don't work for viruses. So like if you got a cold, like there's nothing you can do. You just got to let it work its course. Just little things like that. And then now in today's age with Google and everybody could just look up whatever symptom they just you'll look up something like a hangnail, and next thing you know you got stage 4 cancer and you about to die. Like it's just it's a lot of misinformation that's out there. And even like in my case, certain things like this place is called like Well Now, which is so it's like an urgent care and it's emergency. It's a difference between urgent and emergent. And a lot of people don't know that. So like those little things, like I got a cold, I've been coughing for a couple of days. You don't need to come to the emergency room for that. You could save a lot of time and money going to like an urgent care. So even like that
Yeah.
type of education, like I think people need, they call it health teaching. People need a lot of health teaching to understand that, like, yo, I don't even need to, like I can save money or save time going to a different location, or this is really not an emergency, or like, or I'm it's really nothing I can do. Let me just let it fight its course, or let me get on a diet, do whatever, depending on whatever you got going on in your life. A lot of people have diabetes. It's two types of diabetes: diabetes type 1 and diabetes type 2. Type 2 is primarily for people that are, most people that have type 2 diabetes are like obese, or just not following a good diet. They eat a lot of sugar, et cetera, et cetera. And to combat that, like I said, just follow a strict diet, a healthy diet, exercise, no smoking, just things like that that people don't really understand. That could really affect them.
Yeah. I really appreciate you sharing that. Just a lot of things I think we end up finding out after it's too late. So I think if we had more information, I forget what the phrase is, but I think what they say, ounce of prevention is worth a pound of cure. So like
Yeah.
if you could
An apple a
prevent
day
these
keeps a
things.
doctor away.
Yeah, exactly. But nah, but that goes to like eating healthy, you know what I'm saying, and eating right, and being able to take care of yourself and having access to that. So, one of the other social determinants of health is like actual access to food,
Yeah.
healthy, sustainable food.
Mm-hmm.
And so even if you do have access, like I work for a program like the Healthy Corner Store Initiative. And like, even if you do have access, and like there's programs that are putting healthy options in the stores where people are actually shopping at, making it accessible, like people don't know what to buy.
Right.
Or if you even do. So I've been a part of health fairs, and they was giving out bags of groceries. Awesome, wonderful. But like you didn't give me a recipe
This is
card to go with
bullshit.
it.
Yeah.
No, it might not have been that. They probably just don't know what to do with it.
Right.
So like you gave me a wonderful selection of fresh fruits, vegetables, and ingredients, but like I never cooked with this before, so I don't know what to make, and I don't know what to make that's gonna actually taste good. And so I think in certain health fairs that I've been to, probably like two or three that separated themselves, where they had like it was like a crock pot at the table, and it had like the recipe, like a recipe card, real simple, with the ingredients that was already in the bag, and then how you make it. And so being able to provide that education for people so that that way they knew what to do. I think The other thing you're talking about, I never worked in the ER, but I worked in immunodeficiency clinics when I worked like in different clinics. And I remember one of the things that they would train us to do to assess an individual's literacy level, because a lot of folks have pride. Who wants to come in there and say like, yeah, I'm sick? I was working in immunodeficiency HIV clinics. So who wants to like come in here and really just be like, yeah, man, I got HIV and I can't read? Like, man, who just wants to like say these things out loud,
You can
right? Like,
tell though. I feel like when you talk to somebody, you can really tell like what they're
yeah,
working with for real, for real.
right. Trust me. After a while of experience in different individuals, you can kind of pick up on cues. And so one of the things they will have us do would be like take the whatever the intake form was on the clipboard and then hand it to them upside down. Boom. Now you hand it to them upside down. If they don't flip it right side up and they just start looking at it, it's like, oh, they don't really know what they're looking at. And that's just kind of a subtle way to kind of gauge where an individual who you might be trying to help, kind of gauging where they at without asking them that awkward question. You know what I'm saying?
I treat everybody like they don't know nothing. Honestly, that's good
though.
If they know, they'll let you know, and then you can go from there and set your standards that way. But like if I'm going to meeting a new patient for the first time, I'm gonna talk to you like you're a baby, like you don't know nothing. I'm not gonna use I use layman terms. I don't use no medical terms because everybody, like I said, everybody don't know that, or they might have Googled something and they think that okay, I'm diehard, like I got colon cancer, like just something so off the wall that you just be like, bro, what? Where did you even get that from? So, everybody got their different levels of education or their different experiences that they bring to the table. So I start off at a set level and then we go from there, depending on how the person is.
Yeah. I think honestly, you kind of like led me into like the next thing that I wanted to discuss with you, just because you have so much experience and I have some degree of experience as well. But just thinking about some solutions to like this issue of health literacy or health illiteracy. I know I did a little bit of research here. And according to the Google, it said 1 in 6 adults in Erie and Niagara counties only have the most basic literacy skills.
Yeah.
I can't even talk while I'm talking. It says thousands of them remain functionally illiterate, according to the Program for the International Assessment of Adult Competencies. So we're in a community where, like you said, you kind of got to talk to people like they don't know. Unfortunately, like that's the assumption that you got to make. But I think the key to that is the other element of what you said is like, hey, you just checking the person's temperature to kind of see where they at, and if they got a little bit more to work with, then you can work with them a little bit more. I think that's a great solution. Any other solutions you got?
Nah, like us as medical providers, we kind of gotta. That's our job, kind of to like educate the community. We gotta. So like, if you see somebody, like if I see somebody and they coming in for some bullshit, or they think, oh, I got a hangnail and now I got cancer, you kind of just gotta educate them and let them know, like, this is serious signs and symptoms to look for, or like if a person is obese and they not taking care of themselves, like, yo, this is a diet you could be on, or this is the type of food, or just provide those resources to that person to at least steer them in the right direction. People gonna do what they want to do at the end of the day, but as long as you can steer them in a direction, and if they want to be receptive to it, then they will be, and they can try to make a change, educate themselves.
Yeah, and I dig that. I think so. In addition to that, I think what we're doing right now, in terms of like narrative amplification. So I'm big on narrative, and that's going to more than likely be the running theme. So when we get to the solution part of the conversation, my first solution is always going to be narrative amplification, because the people who are most affected are also people who feel the most apprehension about speaking up.
Right.
So it's like the people who needed the most scared to talk. And I forget who said it, but like progress and change won't take place until the people who are unaffected begin to behave as if they are affected. And so it's gonna take people like me and you who are relatively healthy. I would say you way more than me. But people who have access to education and have access to healthcare and have access to resources and support, such as ourselves, anything that I might be experiencing in terms of a negative health outcome purely is based off my own decision. It's not based off lack of education or the system taking advantage of me. It's based off of my own individual poor choices because I know better and have access to resources. But I think it's the individuals that don't know better, that don't have access, who need individuals such as you and myself to advocate and speak up on their behalf, to communicate to people and be that bridge between the people who need the services and people who have the services.
Right.
So big on narrative amplification. Yeah,
I agree.
Also thinking too in terms of like, where do people put their money at? So I was in a conversation in a training, and one of my colleagues posed this question. She said, "Is Buffalo a healthy city?" And it was a mixed intergenerational space.
The whole America is not healthy. Yeah, we got to single out Buffalo. United States as a whole is not healthy. We got the highest obesity of any country in the world. Like, what are we talking about?
It's wild. It's wild. And in some, but also in some cultures and countries, like having obesity and larger people is a sign of that your country or your community is thriving, and that's
stupid.
That, hey, listen, I'm not saying it's right. I'm not saying it's wrong.
Yeah, what money you want, but if you want healthy, you want healthy, man.
In some places throughout the world, it shows that like your community, your village has the resources to feed these people, and if people aren't starving.
We got of course. People starving. That's other. We got resources, but it's still people starving, and then it's like that just it also can show just gluttony, like just being greedy.
I agree with you. That's
like even our serving sizes. Like if you go overseas or you go to like a different country, the serving sizes is way smaller. Like our serving sizes is crazy. Like big as hell. Like it don't.
Like I think certain people like live to eat. Yeah, we have a culture where people live to eat. And I think I kind of, just based off of having anxiety and toxic productivity, I think I've adopted, and being cheap, not gonna lie, it's being cheap. I think I've adopted a personal philosophy of I eat to live. Like I don't live to eat. So as soon as I'm satiated and satisfied, I'm done. Like I don't want to keep eating, and I don't eat when I'm bored. Like I rarely snack. Like I'm eating a meal or I'm not eating. So I think, but also to your point too, that you were making, strategic investments. So like, where is the money going? You know what I'm saying? Like, are we investing more in the cure? And can we be investing more in prevention? Can we invest in more education? So I think we took health class. I know I took health class. We took it in 7th grade. We was in grammar school together. I know I took it again in high school.
Yeah.
They ain't talked to us about health and nutrition and what exactly to eat. It was more so like how babies is made, for lack of a better term, how your muscles work a little bit.
Honestly, I don't remember. I
just remember the sexual health stuff.
I know certain things in high school changed a little bit as far as health wise when Michelle Obama took away the snacks. Because I think it was my sophomore year, my freshman year, we could buy unlimited. Like they had the best baked cookies I ever had in my life, bruh. And then my sophomore year, they limited us to like one cookie. They started putting like fruits and stuff in our lunch, like, and everybody was so mad. But looking back on it, it was kind of like a good thing, because you would see kids today. I seen a 12-year-old that was bigger than me, bro. Mm-hmm. He was like, first of all, he was tall as hell. It was like my height, like 250. Like you are 12, bro,
and not an athletic.
What is going on? No, like fat.
Like,
for lack of a better term, like he was big as hell. I was like, what is going on, bro? Like, eat a salad. So it's just certain things. certain things like that, you just got to be like, okay, like what's really going on.
So I think, again, to your point, definitely.
And for the people that don't know, I'm 6'3", all of 200 something, like, and that boy made me look like a little kid.
Yo, listen, I was in a school. I ain't gonna say which school, helping out a friend of mine. And I'm sitting there. I was there with her all day, and from like 8 to 3. And when I tell you, it like tripped me out seeing the amount of hot Cheetos and Taki bags that was just being bust open, and Celsius getting chugged like all before noon. Yeah. And I'm like, yo, your body ain't even woke up. Then the one young lady, I'm like, yo, I watched her crack open the Celsius, eat the Takis. Then she's just sitting there, and then she's jittery, and then she's talking to everybody. And I'm like, yo, young lady, you over there wired off that caffeine. She's like, this ain't caffeine, it's an energy drink. I'm like, ooh, baby girl.
That goes back to that education. Girl. You don't even know what caffeine is and what is an energy drink. What is an energy drink? I'm not going to lie. I drink Celsius, but I work overnights. But Celsius I looked at the 200 milligrams of caffeine in them, and they just came out with a big one that got 270 milligrams. So, like, even though I drink it, I read it.
That's why I brought it up. That's why I brought it up.
I did some research. I know how much caffeine is in it, but
you're the first person I ever seen drink that. But you say I'm drinking coffee right now as we talking, so I ain't no better. But also, like, I understand. I'm literate. I understand the impacts of what this is doing. I'm strategic. Like, I'm drinking. I only drink one as a supplement.
I see people that drink like 2 or 3. Like, that's crazy. I drink like one, and then if I'm tired still, I'm just gonna take that L.
You're drinking it for the flavor, because I had Celsius before. It don't taste bad, but you're drinking it, and like, listen. When I went and grabbed my coffee and came back into the office, I said to one of my coworkers, like, "Yo, this is like one of the most widely accepted addictions there is in the world. Like, caffeine is a drug." And so, like, to say that, like, yeah, exactly, and alcohol, and so to say that, like, I'm not an addict to caffeine, I would be lying. I would be lying to myself.
Some people think some people think that if it's not a drug, you can't be addicted. Like, that's far from the facts.
Or some people have drugs that they think are okay and drugs that they think are not okay. Like, drugs are drugs. You know what I'm saying? They gonna impact your body in a certain kind of way. You just gotta decide what you taking and why. Like, I'm taking the caffeine drug to perk myself up a little bit, to be a little more energetic and a little more jittery and with it and in tune while I'm engaging with the people, because I was real laid back and chill otherwise. I'm a laid back dude 9 times out of 10, unless I'm off the coffee. So just being strategic, but that caffeine was whooping baby girl tail in that class, and she was arguing me down. And like, then the boy, he eating the blue Takis. I'm like, young man, nothing in nature that you eat is that color blue. Like, there ain't blueberries ain't even blue. Yeah. They like purple and red.
I never had Takis before.
Me either, because I don't want nothing that color. I mean, maybe a beverage. I'll drink a funny colored beverage, but I can't get with the food part. Maybe that's just where I draw the line. But then I asked the young brother, I said, yo, my man, read the ingredients and like stop when you like start getting to like words that like you don't know and say them out loud. Try. And he was stumbling on them words. I'm like, bro, you eating all this stuff, you don't even know what's going on in your body. But he was like, yeah, I don't care. I'm like, yo, but nobody is making it like a point of conversation. Nobody is making it a big deal in their culture. So I think we got to continue to change the narrative. We got to invest in having healthy educators and people who know have nutritionists come into school and do a session. So I know when I worked with the sexual health program, we would come in and supplement the health teachers talking about HIV, AIDS, teen pregnancy, birth control. because maybe they didn't feel totally equipped to do it. Because you're a health teacher, this isn't your area of expertise. You might be the gym teacher, and this ain't your area of expertise. And so you bring in community partners who do this kind of stuff all the time. And so maybe we need to do stuff like that when it comes terms to like nutrition and wellness. I know a lot of nutritionists, folks over at Duville. My homegirl Rachel, she does nutrition. Like I said, I work in Buffalo for the Healthy Community Store Initiative, Healthy Corner Store Initiative. People probably don't even know that the Healthy Corner Store Initiative even exists in the city of Buffalo, and it's funded through New York State and Cornell Cooperative Extension in a collaboration with UB. So like it's these resources out there. It's just being disconnected from the people who have it versus the people who need it. So I don't know. If you're watching this, get into the comments with your solutions, man. We want to hear from the audience. Want to know what y'all think on this topic regarding health and health literacy. Right. Anything else that you want to share, bro?
Nah, man. I think like I said, we just gotta educate the people, and people gotta be willing to accept the education. Because you can educate all you want, but if they don't want to accept it, then you're just talking on deaf ears.
That's a fact. You could lead them to the water, but you can't make them think. Word. So, as we begin to close out on this first episode, again, appreciate you rocking with us. If you're listening, make sure you click the like, make sure you subscribe, make sure you get in the comments, tell us other social determinants of health you want us to talk about here on this platform. Is there any key takeaways from our conversation that you walking away with? Anything from my perspective, anything that you understand better about your own perspective that you're walking away with? And is there anything you plan on doing regarding this social determinant of health going forward?
Me?
Yeah.
Well, I thought you were talking about the audience.
Man. Them too, but I want to hear from you.
Shit, man. Health is wealth, man. You gotta treat yourself right, man. If you want to, there's people living to be older than they ever been, man. People's 100 years old, still up walking, chilling, know what's going on, man. So you just gotta treat yourself good now to be here, to be around later. Like health is wealth, man. Exercise every day, eat right. And then we're not saying like, oh yeah, you gotta just don't eat no snacks. Nah, I like to snack, but you gotta, do it in moderation. Work out every day. Eat you just gotta. I believe in the 80-20 rule. 80% healthy shit, 20% bullshit. So you could still indulge a little bit. I went out to eat yesterday. Had a rib and
single rib?
Steak. A half rack of ribs and some steak. That ain't really that crazy of an unhealthy meal, but that was. I've been really getting to it lately. So I've been I haven't been eating a lot of nonsense at all. So that was a deviation for me. You just gotta, just treat yourself right, man. Summer coming up. Everybody want to look their best, man. And this is a start, man. Even a lot nowadays, everybody just want to go get surgery, but you can go get surgery and then turn around and still gain weight because you're still not eating right. You still have to do the things that you have to do to get it off. Even if you get the surgery, you still got to work out. You still got to eat right, or you're just gonna gain it all back and you wasted your money. So health is wealth, man. Treat yourself how you want to be treated.
Nah, that's a fact, bro. I appreciate that. I think just now I'm gonna take that perspective as my takeaway. Most definitely health is wealth. And definitely treat yourself, but educate yourself, man. Yeah. Don't be afraid to ask questions. So I think the other thing as we close out, folks, when they go to the doctor's office, it's always a power dynamic whenever they're engaging with a medical professional, whether they got
go
the white
to the
coat.
Doctors, man. I know it's a lot of dudes, my bad. I know it's a lot of men that do not have a primary doctor, never been to a primary doctor since they had a pediatrician. You stop seeing your pediatrician at 21, 22 maybe, max. We in our 30s, man. A lot of my peers is in our 30s. They ain't never been to the doctors, man. At least go get a physical, get some blood work done, man. You could be walking around with some stuff that you don't even know, man. If y'all out here doing whatever y'all doing, man, go get STD checked, man. Like I said, health is wealth, man. Get a primary doctor, man. I worked with a dude, bro. Another nurse that had never seen a primary doctor, man. Like what? I set him up with a doctor, bro. He was complaining about his stomach. He having GI issues, his stomach all jacked up. I'm like, bro, go to the doctors. I set him up with a primary doctor, man. I found I looked online because he wasn't doing it. I looked online and had him call these people, and he set up an appointment. So like, you gotta be willing to do it, man. Health is wealth.
Nah, that's doctors, real.
Man. Get checked up.
That's real. So
niggas
on that
nasty,
point,
man.
On that,
yeah, nasty.
We knocking stuff over, laughing, but nah. But keep it real though. Like I didn't have a primary care physician until like I started working full time here at the center. So like I ain't gonna I what Ocho Cinco say, I lied for you, but I never lied to you. So yeah, I just now crossed over into that. Yeah, y'all need to go to the doctor. Yeah,
well, sure, people need to get what could be PCP. Wrong with you, man. That's a fact. I've been seeing so many young people that's in dialysis and getting kidneys removed and stuff. Like, yo, y'all too young, man. Yeah. Go to the doctors. At least get your vitals done.
No, that's
check
key.
Your blood pressure, check your heart rate, man.
That's key. Yourself, man. Yeah, we deserve it. We got to be here for our families, and just prioritizing ourselves. To be honest, you know what I'm saying? Just prioritizing ourselves, prioritizing taking care of ourselves, and being here, and doing things in moderation. So I definitely agree with everything that you said. I feel like this has been a great conversation. Yeah. I'm looking forward to see what folks gonna have to say in the comments regarding this topic and these topics, especially that 80-20 thing. Because I feel like a lot of folks got that flip where like they like, I could eat a bunch of bug and then wash it down with a salad. Or even like me, I have straight steak sub and some fries and be like, let me get a naked smoothie and a V8 juice and balance it out.
You might as well just drink a Pepsi at that point.
Yeah. So I think just continuing these conversations amongst us and ourselves as men, most definitely. And yeah, just encouraging each other to take care of ourselves, man, making that the norm. Before you ask about how the Bills doing or who just dropped a new mixtape or what movie coming out, man, ask your friend how their kids doing and if they've been to the doctors lately. Let's work that in your conversation. That's all we trying to do here. We ain't trying to say necessarily stop doing a bunch of stuff. We trying to say start doing more of this stuff. You know what I mean? And that's all I'm really kicking it about it and where I'm coming from on that. I mean, I ain't trying to shut down nobody's stuff. Just trying to encourage y'all to do a little bit more. Yeah. Anything else that you want to add, brother, to the people, where they can find you at, how they can follow you, stay in contact with you as we continue to do this show here?
I'm Trevor Ransom on all platforms, man. Trevor Ransom on all platforms.
Word. And I am your co-host, Sherman Webb-Middlebrooks, the lifelong Buffalo resident, full-time Black man. You can follow me on all social media platforms at the Full-Time Black Man. And yeah, this has been another episode of Igniting Hope Radio, brought to you by the Buffalo Center for Health Equity. And yeah, we out. Peace.